Sharon Williams, can you give some information on lipodema? I think lipedema is what you're saying. That's swelling of the, it can be upper body as well as lower body. Upper body is most commonly associated with the surgical procedure where you remove the lymph nodes. In the good old days when they would do mastectomies on women, they would also remove the lymph nodes, and that would interrupt lymph flow, and they would always have a big swollen arm that they had to keep wrapped up, and difficulty using it. It becomes heavy, becomes weaker, etc. You can have lymphedema of the lower extremities that can be as high as the buttock. The lymph flow is where fluids come out of your capillaries as blood moves down from the large arteries down to the capillaries. There's only space for red blood cells, and so all the fluid that is floating in comes out of the blood vessels, and it floats under the skin in what's called a lymphatic system. The lymphatic system returns it back to your circulation when it's functioning normally. But if for whatever reason this system of plumbing or tubes or pipes or whatever you want to call it, it's in your body, it's supposed to move that fluid will collect. Now you may notice if you sit down for an extended period of time, if you have a job at a computer and you're sitting at your desk for extended periods of time, that fluid will build up mostly because of gravity, because the action of actually walking will strip that fluid from your legs and move it back toward the center of your body, where you are either urinated out or it gets back into your circulation. So you have to move. If you're sitting down, you need to get up at least every 2 hours, take a few laps around your desk or in your workplace. You don't have to go outside, but you need to move. Even when you're sitting, you can just rock your feet up to the balls of your feet down to your heels. That action that closes your calf off will help move fluid from your legs. So no real treatment other than compression therapy. There are some physical therapy locations that specialize in lymphedema, and they really can do a great job in moving that fluid, but it's a continuous process and problem. You have to stay on top of it. You have to stay hydrated. You also have to take diuretics. So it's a complicated balance of keeping the fluids in your body at a functional status without you resorbing fluids. You have to monitor your salt intake as well.